Women are 3 times more likely than men to develop carpal tunnel syndrome. And a study found that heavy computer use did not increase a person's risk of developing carpal tunnel syndrome. We spoke with Dr. Nicholas Rose at Hoag Memorial Hospital Presbyterian in Newport Beach, who gives us more information on this disabling condition.
Well, carpal tunnel syndrome is a compressive neuropathy of the wrist. Basically, in the wrist, you have a tunnel, a structure whereby 8 tendons and a nerve go through this tunnel, and it's a normal anatomic structure. And what happens in carpal tunnel is that for some reason the tunnel gets too tight and the nerve gets compressed. And it typically happens, your typical patient is going to be a female between the age of 40 and 70.
We asked Dr. Rose, what are the symptoms?
Patients classically will have numbness and tingling at night that wakes them up. They'll have numbness and tingling when they drive. A lot of patients will actually complain of the sensation that their hands feel swollen. And even though you look at their hands clinically, they don't look swollen, they'll have that feeling or they feel tight. And then patients even can have radiating symptoms that cause shooting pains all the way up to their shoulder and their neck.
And Dr. Rose told us what causes carpal tunnel syndrome.
There are certain conditions or diseases or states that can lead to carpal tunnel. Pregnant women can tend to get it because of hormonal changes that happen during pregnancy. Diabetes is a predisposing factor. Patients with rheumatoid arthritis, and then patients with hypothyroidism, low thyroid. So it doesn't mean if you have carpal tunnel that you have these conditions, but those are just certain conditions that place patients at risk for developing carpal tunnel syndrome.
And how is carpal tunnel syndrome diagnosed?
On examination, we look for 3 provocative tests. Basically, what they are is we tap the nerve, we compress the nerve, and then we put the wrist in a hyperflex position. And if any of those 3 things, or all 3 of those, recreate the symptoms, that's diagnostic for carpal tunnel. Secondly, we see if they've lost some muscle mass in the base of their thumb. This muscle right here, your thenar muscle, in long-time carpal tunnel will start to flatten. We call that atrophy because the nerve also supplies input to that muscle as well. The other thing is that a lot of patients will have numbness in the thumb, index, and middle finger. So clinically, we can make the diagnosis. The next step usually is we send the patient to a neurologist or a physiatrist, and they do what's called electrodiagnostic studies. In patients in whom you're maybe unclear the diagnosis, or especially patients who maybe have had a history of neck problems or herniated disc in the neck where you may not be sure, is it coming from the neck, is it coming from the carpal tunnel? In those patients, what you can do is inject the carpal tunnel with cortisone. And if the patients have relief for a period of several weeks or months, that will be diagnostic for carpal tunnel syndrome as well.
Dr. Rose told us how the condition is treated.
The carpal tunnel injection is a diagnostic tool, but that's also a therapeutic tool. Sometimes a cortisone injection will provide patients with 2 to 3 months of relief. The second way we treat it is usually with night braces. We have them wear a brace at night that keeps the wrist in a neutral position, and that avoids the hyperflexion of the wrist that can aggravate the symptoms. And then finally, the third thing is avoiding the activities that maybe cause it. We talked about using vibrating tools, or if somebody is doing a certain activity that brings on that numbness and tingling, simply cutting down or eliminating that activity could do it. And then finally, the gold standard for carpal tunnel is surgery. Literally, you go in there and you open the roof of the tunnel and you decompress the nerve. It can be done open or endoscopic. It's a 10 to 15 minute outpatient procedure. There's no cast, no brace, and patients can really start using the hand right away. They'll have some soreness in the base of the palm for up to a couple months, but decompressing the nerve in true carpal tunnel has about a 95% success rate.